So in this video, I'm going to do 4 things. I'm going to do thermoregulation. I'm going to do bulb suctioning. I'm going to weigh on the baby, and I'm also going to I'm going to measure the head, the chest, and the abdomen on the baby. So when coming into the room, I'm going to introduce myself to the parents. I'm going to explain the procedures that I'll be doing, allow any questionings, obtain permission from the patient. Then I'm going to wash my hands. I'm going to provide for privacy, and I'm going to down gloves. Okay, so the first thing I'm going to do is thermoregulation. Okay, so what I'm going to do is I'm going to check any doctor's orders. I'm going to put the radiant warmer on 37.0 degrees Celsius so they can start getting warm. Then I'm going to get items that I might need, a stocking cap, the footprint sheet, diapers, the armbands for the baby, towels, and any newborn medications that I might need, okay? Once I obtain all of the things that I need and I have the baby, I'm going to place the baby in the radiant warmer, and I'm going to wipe the baby down really good, wipe any blood, any fluids, or any excess vernix that's on the baby. And then if I'm gonna make sure that the airway is clear, and I'm gonna bulb suction the baby. If suctioning is needed. Okay, and then I'm going to obtain the baby's APGAR score. I'm going to obtain the baby's weight, the baby's length. I'm going to, baby's weight, baby's length. The baby's length. And then I'm going to get the measurements with the circumference, with the circumference, okay? Once I've obtained all of that, then I'm going to, if the baby is stable, then I'm going to wrap the baby in a blanket. I'm going to place a cap on the baby, and I'm going to place a diaper on the baby, and I'll give the baby to the parent so the parents can spend some time with the baby. Okay, once the baby has spent time with the parents, then I will get the baby back. I will put the baby back in the warmer, but I would take off the blanket. I would only leave on the cap in the baby's diaper. Okay, and then also I will put on servo. I will put on a servo probe, a servo temperature control probe on the baby. And I will place that on the baby, making sure that the metal side is to the skin. And this is to ensure that the baby stays at the temperature of 37.0 degrees Celsius. Okay, so now that I've done thermoregulation, the next thing I'll do is weighing the baby. So with weighing the baby, you have your scale, okay, and you want to place a barrier on the scale. And once you place the barrier on the scale, you want to set it to 0. Once you have your scale set to 0, you want to place the baby on the scale, and you want to make sure that you keep your hand close, by the baby, to make sure that the baby, safety issues. Okay, and then you want to get the weight of the baby. Once you've obtained the weight of the baby, you want to record and document the weight. And then you want to get the baby, and you want to dress the baby, put clothes and things on the baby as needed. Okay, so that's weighing the baby then I'm going to do bulb suctioning. Okay, so with bulb suctioning, you want to check the doctor's orders. Okay, then you want to tilt the baby's head back, and with the nose, you want to squeeze 10 to 20 drops of saline into the baby's nose, and this is to help to thin out any secretions. And depending on if the secretions are thin already, you may not have to do this step. Okay, and you want to clean the bulb and repeat it if you need to repeat it. Once you've done that, you want to suction out. When you're suctioning out the baby's nose and the baby's mouth, you want to compress the bulb. Then you want to put it in the baby's mouth, and once it's in the baby's mouth, you want to slowly decompress the bulb to be able to get any mucus and secretions from the bulb. Okay, and then you want to do this for the nose and the mouth until the baby is clear and the airway is clear. When doing repeats, you want to make sure you clean the bulb as necessary, and repeat the steps if necessary. Okay, so that concludes bulb suctioning. Then what else I need to do? I did the weight. I did the bulb suctioning. I need to do the measure. Okay, the last thing I'll be doing in this video is measuring the head, the abdomen, and the circumference. Okay, I don't have a measuring thing, so I just use this just to demonstrate. But okay, you want to check the doctor's orders. Okay, and you want to use a paper tape that has centimeters and inches on it. Okay, and when you measuring the baby's head, you want to make sure that the baby don't have a cap on it, any type of barrettes or anything in the hair or on the head. You want to make sure you take off. Okay, and when measuring, you want to measure the supraoccipital prominence on the head, and because Mickey's ears way up here, you want to go above the eyebrows, and you want to go above the ears. You want to go above the ears and above the eyebrows, and you want to go below the occipital prominence. And once you obtain the measurement, I'm going to go to below the ears on Mickey only because his ears is up higher. But you want to go in below the occipital prominence. Once you obtain the measurement, you want to double check the measurement just to make sure that you got the correct measurement. Okay? Then for doing the chest, you want to go right below the axilla, right below the axilla, and at the nipple line, and go around to the back. If there's any clothes, on the chest or the abdomen, you want to take the clothes off as well to make sure you get an accurate measurement. So once you get that measurement, again, you want to double check just to make sure that it's accurate. Then to do the abdomen, you want to measure at the umbilicus, the belly button, right at the umbilicus, the belly button, and then you want to go around and get that measurement. Also, you want to double check that measurement again. For any reason that you have to go in a different spot, you want to make sure that you put like a little line, where you measured it, so and document the location, document that you measured it a different location, so that way when they're doing I was about to say regiments, future measurements, they'll be able to get an accurate measurement because they'll go in the same place that you went previous times. Okay, once you've gotten all of your measurements, then you want to document those measurements. Okay, and once you document those measurements, then you want to clothe the baby appropriately. Okay, and that concludes this video.